Hey everyone, I'm Laura.
I'm Sam.
And I'm Jess, and we are Level 4 Compressed Timeframe Western Nursing students here to address the wicked problem surrounding lengthy emergency room wait times. For the purpose of this vlog, we will be focusing on the two emergency room departments found within the London Health Sciences Centre, or LHSC, which are University and Victoria Hospital. The current Ontario average for emergency room wait times is between 2 and 5 hours. However, LHSC emergency rooms have wait times averaging between 5 and 27 hours, depending on the complexity and acuity of the condition. Emergency room wait times are more than just an inconvenience, as patients have shown to develop further issues and complications as a result of untimely delivery of care.
Improving emergency room wait times is of interest to the public and may seem simple. However, the solution to this problem is very complex due to the multitude of contributing factors. It is necessary to think about the social determinants of health and how they apply and contribute to this problem. An individual's income, race, access, and education all impact the decision to seek emergency room care. Those experiencing mental health challenges, addictions, and homelessness tend to use the emergency room services more often than the general public. Reducing emergency room wait times will increase patient satisfaction and health outcomes. To tackle this wicked problem, we are recommending 3 main ideas. Option 1, effectively managing chronic health conditions. Option 2, improving primary care services. And Option 3, enhancing community and social supports.
Option 1, effectively managing chronic health conditions. We propose strengthening current practice and discharge protocols to empower patients in managing their chronic health conditions. A large proportion of emergency room visits can be attributed to individuals suffering from chronic health conditions who have been readmitted due to avoidable complications. A main factor involved in readmission is the inadequate preparation of patients and their caregivers during the hospital discharge process. Patients are often being released from hospital without the proper knowledge, skills, and resources to manage their chronic condition. The goal of this option is to enhance effective patient teaching, documentation, and timely patient follow-up during discharge.
Option 2, increasing access to primary healthcare providers. Evidence shows that as many as 37% of emergency room visits are non-urgent and could be appropriately managed by primary care providers. Common reasons for visiting the emergency room for non-urgent conditions include not having a family doctor, reduced access to primary care providers during evenings and weekends, and an inability to get timely appointments. In 2014, Statistics Canada reported that over 1 million Ontarians did not have access to a family doctor. Rather than patients visiting the emergency room for conditions that could be treated elsewhere, we recommend that alternative facilities be made more available and easily accessible. This can be done by implementing services such as walk-in clinics that are open 24 hours, 7 days a week.
Option 3, enhancing community and social supports. Recently, mental health treatment facilities in the London and surrounding area were restructured. The number of available beds was cut in half before strong community resources were put into place. This resulted in a lack of support for individuals trying to integrate back into the community life. Currently, the only in-person 24-hour service for mental health and addiction crises in London is the emergency room. To reduce emergency room visits, it is critical that a 24-hour face-to-face alternative clinic be available to those living in the community.
After considering the options, we have decided to implement Option 1, effectively managing chronic health conditions. This is the most beneficial solution to reduce emergency room wait times because of the heavy burden illnesses place on Ontario's healthcare system. 80% of Ontarians over the age of 45 have at least one chronic illness. Evidence shows effective discharge protocols including education, self-management teachings, and follow-up phone calls can decrease readmission rates by 48%. Therefore, the most practical, short-term solution to solve the wicked problem of emergency room wait times at LHSC is to target these chronic conditions. Thanks for listening.